Hi everybody, Dr. Alex is here, and today we are talking about malaria diagnostic here in Diamed Diagnostical Center. For me, person who born and raised and practiced in malaria-free region, it's extremely difficult to spot the malaria on clinical manifestation. So you either suspect it in any given case or miss it. So I rely on the lab because the symptoms are very unspecific. These things that you will reading in the books not working at all, the black water urine and the intermittent fever 3 days 4 days, please forget about this stuff. The symptoms are very blended and they characterize hundreds of thousands of disease. Okay, joint pain, muscle pain, nausea, the headache, stomach ache, sore throat, sweating. These symptoms, malaria shares with bunch of other diseases. So to properly diagnose the malaria, we need to rely on the lab results. And now I'm gonna share with you how we approach this malaria diagnostic in our Diamed Diagnostical Center. So let's go with me to the lab. Philip, I'm coming to you. Wow, seems to be very decent lab here in Diamed Diagnostical Center in Takrady. Okay, this is our senior lab technician. What are you doing, Philip?
Running some samples on malaria.
Could you please update me with the latest information about malaria diagnostics?
Okay. This is Diamed Diagnostical Center, Takrady. Talking about malaria, we have 4 different types of tests that we can use to diagnose malaria. And what I'm doing is the microscopy. First of all, to start with, you need a patient who has been presumed to have been infected with the parasite. You need your lancet, your slide, your Jameson stain. Afterward, you disinfect the patient's finger that you take the sample from. You take a drop or 10 microliters of the sample and prepare a smear. It can be a thick smear or a thin smear. After which, you air dry, you fix the slide, then you stain. After the staining, you wash. After washing, you dry again, then you will use the times 100 lens of the microscope with your oil immersion. Then you observe, and then you can see if the person is really infected with the Plasmodium parasite. And with the thin smear, you can be able to differentiate or identify the various types of parasites. But with the thick smear, you only see randomly every parasite which the patient has been infected with. And after that, you can tell that yes, this person has been infected with the malaria parasite. Then the doctor, you give the report to the doctor or to the patient to take to the doctor. And afterwards, the doctor will diagnose the person by the tests you have provided. Will be diagnosed with it and proper treatment will be given. So that is it with malaria. And the advantages of the microscopy is that it's easier, it's faster, it's quite faster, it's convenient, and also it's cheap, but it is very accurate also. So most labs tend to use this method than any other of the other 4 methods that are used in diagnosing malaria. So that is it. And the disadvantages also include it's not it's not readily available, as in you can do it. It's not a home-based remedy that you can use to diagnose malaria. So aside that, and it also needs a professional. So with the aside the microscopy, we also have the PCR, which is the polymerase chain reaction test. This test is extremely accurate and is used in diagnosing. It allows you to identify the genetic makeups of the parasite, which is the malaria, and it's highly sensitive and highly accurate. And it requires a highly trained professional, and also because of the nature of the test, it's mostly done in research labs, because the equipment needs which are used in performing these tests is very expensive, and not any lab, just every lab can afford it. So it's rather the research centers that use these machines. So this kind of test is done in research laboratories. And also we have the indirect fluorescent antibody, which is the IFA. It's also used in detecting the post-malaria infection, and also someone who has been diagnosed with chronic malaria. And this is used to see whether the person is reacting to maybe medications given the person is reacting positively to it, or it's still in the state at which it is, or the condition is getting worse. And this test is also very expensive, and also is done in specific labs like scientific labs, research labs, and it's not readily available, and it's also very expensive as to that of the PCR. And lastly, we have one that is the ELISA, that is the enzyme-linked immunoabsorbance assay, and this test detects both the antigens and the antibodies of the malaria parasite. And this is also very good, and the advantage of this test is it doesn't need any professional, mostly doesn't need any professional, because there are kits readily available for this kind of test that you can do it at home. And mostly these ones the kits are mostly using when we're going for screenings. So we can't carry all our machines along, so we take these test kits along, so that it will facilitate, to help us be more efficient and provisioned during the field work like screenings and others. So that is it for the ELISA. In our facility in Diamed Diagnostics Center, we mostly perform the microscopy because it's readily available, it's simple, easy to use, and it's very affordable, that anyone can afford that test. And by the use of microscopy, we also will be able to identify the various parasite, whichever parasite, malaria parasite, which the patient has been infected with. And through that, the doctors are able to give good diagnosis, excellent diagnosis, and treat the person to the highest standard. So that is what we do, and in Diamed Diagnostics Center, basically. So I will entreat you to come with any health problems. Call us. You have our numbers down there. Call us and we will attend to you. We have excellent doctors, we have excellent human resource, we have excellent human resources, we have excellent nurses, excellent workforce. You will love it. It's a home away from home. I bet you'll be sure with that. I tell you, just come and experience. Ciao.